This video to me is very exciting. It's as exciting as the meso Botox video I shot that's about 25 minutes long because they go hand in hand together. So dynamic fillers is a massive category that I started engaging in a year ago when I listened to a great lecture in Washington, D.C. by accident. It's funny, a colleague of mine sat next to me and he got nothing out of it and I was blown out of my mind. And it was by accident. I was actually listening to a lecture. I was going to listen to a lecture about cadaveric fat, and the person didn't show up, and I heard this Dutch doctor talk about this technique, and I just was absolutely flabbergasted at how incredibly it filled a niche that I had. So what a dynamic filler is a filler used not for volume, so this is very different. It's actually used for wrinkles that are dynamically visible. So in other words, when you smile and when you move your face, these dynamic fillers are not adding bulk to the face, they're not adding volume, they're managing a crease that shows up only when you really smile. Although I've also used it for static scars as well. In fact, I just did that this morning, which is what prompted this video to understand that I really want to develop this video. I shot a podcast on this subject about 6 months ago, but every time I do this, I constantly evolve my thinking. So I wanted to explain to you what the importance of this topic is. So first I want to talk to you about what role does this play in the aging face. So first I want to talk about the fact that I divide the aging face into three components: skin, volume, and gravity. I shot a video about that. So if we take volume and gravity and take it off the table, we're only talking about skin right now. So with skin, we're talking about rejuvenative capacity of the skin. Now there's a lot of things I can talk about with skin: acne scarring, active acne. I can talk about, other irregularities, deep areas that need to be maybe resurfaced, etc. I'm specifically talking about skin in terms of two components: dynamic problems and static problems. What are static problems and how do I fix it? What are dynamic problems? So first I want to give a context to understand that the upper third of the face is managed statically and dynamically with Botox, whereas the lower 2/3 of the face, traditionally we look at lasers and other therapies to manage these areas of aging, but lasers really don't work. And I own multiple lasers, and I do use lasers in different ways, but I'm going to explain to you a better way to approach this. So upper face, we do Botox, and Botox is wonderful, but Botox is almost too wonderful, because if Botox is done well by a qualified injector who's talented in what they do, not only are the wrinkles improving, but the quality of skin looks better. The pores, the texture, the tone, lesions. If you've been doing Botox for years, look at your forehead carefully and look at down here. You're going to see there's a mismatch. This forehead looks too good. And if you look at people that don't do Botox, this is the worst area. They have the worst creases, the worst texture, the worst pores, because it has the most sun damage. And it also is the area that has the most movement, which causes fragmentation of the collagen. So it's sort of interesting. And people say, I want to look natural. And what they don't realize is that Botox not only manages the wrinkles, but it manages the pores, texture, tone, and quality of skin. So then there's this imbalance. There's a mismatch between the upper third and the lower 2/3, and then you're struggling to fix this by doing fillers or a facelift, and those don't manage the skin parity. So yeah, I believe in facelifts. I have just shot a 5-part series on facelift technique that I do, deep neck lifts, etc., but that's not managing the skin. So if we don't compartmentalize each of these components, we will have a misunderstanding. Like a lot of dermatologists say, if you fill more big enough, it's going to lift the face. Absolutely garbage. That is nonsense, okay? You cannot fill the person big enough to lift the face. It will not happen. Not even, well, here's what's interesting. They actually did a study where they looked at, does it elevate this, does fillers elevate the skin? And they actually do by 1 millimeter. 1 millimeter, okay? 1 millimeter. So if I did facelifts with 1 millimeter improvement, my patients would never be my patients. So understand that filling does not create elevation. Sorry for that quick aside. But let's go back to dynamic fillers. So if the upper third of the face is managed both dynamically and statically, that is dynamic wrinkles and movement and also quality of skin with just one thing, concentrated Botox, how do we fix this? So if you listen to my 25-minute video on mesobotox, I used to try to manage the dynamic wrinkles with mesobotox. It's very hard to treat. You have to do it so many times and you still have an early failure. So I gave up on doing that when I realized I have a better mousetrap. I have a better way of dealing with this. So the easiest way to categorize the lower 2/3 of the face is dynamically and statically, because unlike here where Botox, concentrated Botox manages both dynamic and static problems, the lower 2/3 of the face has to be divided into dynamic and static problems. So static problems, meaning pores, texture, tone, collagen, quality of skin, maybe even rosacea, melasma, dyschromias, even active acne, minor textural issues are all done with mesobotox. This video is not about mesobotox. I encourage you to listen to that 25-minute video on that subject, but that's how I manage static problems. So in the past, if you looked at an old video about mesobotox, I talked about managing the dynamic wrinkles, and I got success with it, but limited success, and it took way too long to get that result. So now I look at mesobotox as a way to manage static problems, quality of skin, pores, texture, tone. Dynamic fillers are to manage wrinkles that go down the face. So when you smile, you look at the patients that only get Botox every year, they have these advanced lines that go down the face, and those are not managed with conventional Botox. It can't be managed with a laser. Why can't a laser fix it? Because I always like to use an analogy. It's like ironing a shirt and wearing it. The laser may give you some temporary gain. It's not going to do much, okay, first of all. And it has risk. You can have hyperpigmentation, hypopigmentation. You can have possible scarring if it's done inappropriate, where this Botox and fillers have really almost no risk. You can reverse the filler. The Botox really has no long-term negative effect. It can be done safely in all skin types. So if you're an African-American, are you going to do a laser? Unfortunately, I've seen people come in and get a laser on their skin. It's ridiculous. You should not be doing a laser on your skin for an African-American. Too much risk and too little reward. And that risk is really dangerous. So the way to understand the dynamic problems is using filler. Now, what do? I use a very thin filler, Restylane Silk, and I do it in a cross-hatching method where I'm going outside of the wrinkle, and that wrinkle immediately goes away. It's amazing at what happens. You start to see this wrinkle fade, and I'm hitting both sides. If it's very advanced, I usually need 2 syringes, sometimes 3. If it's limited, it's 1. The other benefit it does is that just crow's feet. Think about this. If you get Botox on a regular basis, where does Botox fail? Where does it underperform? It's crow's feet. Okay, it underperforms in crow's feet. So what I use this filler for is to manage crow's feet and lines that go down the face dynamically. So the way I do it is sort of weird. You're smiling and holding your smile during my injection for 5 minutes. I'll if I take a break, you take a break for a second, but you're holding that smile as much as you can. And so I'm managing the crow's feet. So what that does is it makes your Botox results look much better. Your regular Botox looks much better, and it makes it last much longer. So you get longevity with your Botox and improved results. And that's a big win, even if you don't have long wrinkles. If you listen to this video and say, look, I don't have these wrinkles that go down my face, but my Botox doesn't last that long, it doesn't look that great in this area, it just fails quickly, you're still a candidate for this. And so that's what I use for these dynamic fillers to understand how I use it for. Some issues that you need to understand with this is that when I not do it? So here's the one thing. I don't like to do it immediately after Botox. In other words, let's say I do your Botox, whether it's mesobotox or regular Botox, you come back a week later and say, you know what, I really want that dynamic filler right now. The problem is your wrinkles are already reduced with the Botox. I can't read the fillers. Can you get it safely? Sure. You're just not going to get the absolute value. So it's always better for me to do the filler either immediately, like 30 seconds before I do your Botox, or 3 months later at minimum when the Botox is faded so I can read it better. That way you get the optimal value. It's not like I'm hurting you if I did it a week later. I just won't give you the optimal value, because if half your wrinkles are already reduced with the Botox, I'm missing half the wrinkles with my filler. So ideally, I'm doing that filler immediately before the Botox. Of course, if it's the same day and I just did your Botox, I can't read your wrinkles because I just did your Botox. So you need to let me know before I do your Botox, either again, a few seconds before your Botox or 3 months later. That's my ideal time to do the filler. The filler has a slight more discomfort than my normal Botox. Now, Listen to my video where I talk about stupid pain. It's not that painful, it's slight discomfort. Most of my patients, about 80 to 90%, just do it with no numbing, but I would be more than happy to do some numbing. I can do it what I call express numbing, about 15 minutes of numbing cream, or I can do it for a full 30 to 45 minutes if you have the luxury of time. So I would say about 10-20% of my patients just like it to be as good as possible, but it doesn't hurt that much, but there's a little more discomfort than my Botox. So some of my patients just prefer some numbing, which is totally fine. It's a minority. Where it's interesting with mesobotox, I would say about 60 to 70% of my patients do numbing, whereas with my dynamic fillers, only a minority does. But if you can do both that same day, which you can do, I can definitely do numbing if you want it, just numbing cream. In terms of the recovery time, so with this is that you do have more bruising with this, but let me explain to you what bruising is, because when people hear the word bruising, they think big black blue stains that last a few weeks, and that's not what this is. The injection is intradermal. In other words, it's placed very superficially, and it's got to be controlled exactly the right amounts to layer that area, because if you go too superficial, you get bumpiness, and if you go too deep, you get no benefit. You just add volume, and that's not what I'm trying to do. So it has to be precisely placed in a way, and it's not filling the wrinkle. As I said, this technique, it's a cross-hatching method going outside of the wrinkle, not into the wrinkle, which is the opposite of what I'm trying to do. It's counterintuitive, okay? And sometimes I hit some linearity, sometimes I go cross-hatching, but it really is amazing when you see that change. So you get this superficial bruise, because if you think about, I talked about this in some other videos, the dermis does not have a lot of blood vessels, and it's only 2 to 3 millimeters thick, and below it are the blood vessels. So yes, the needle could penetrate a little bit farther, especially near the eyes. There could be a little bit of bluish stains, but it's more of a superficial bruise. It looks like someone spilled wine on your skin, so it's very obvious. And not everyone. Some people get away with almost no bruising. I did my staff member the other day, she has 0 bruising. But most times, I always like to talk about worst case scenario. You'll have this sort of a superficial bruise on your skin that is there for usually about a week. My wife, I did hers in December, and she found this product on Amazon Prime that was amazing, and that's why I have it all written out for my staff, all my patients, called Dermacol, D-E-R-M-A-C-O-L. I don't think it's for darker skin types, but it's an amazing coverage. We're at a party with 300 people that night, and no one could see that she had it done. We're at 3 Christmas parties, no one could see that she had this done. So this makeup in general covers really well. For men, of course, the problem is men don't like to wear makeup, camouflage, but understand for men, there are gonna be a few days to a week where there's gonna be an obvious stain on the skin in the worst case scenario. Most times it's resolved within a week. So this makeup product, I encourage you to buy it before you come and see me. It seems to knock down and cover most of that superficial bruise quite quickly, and allows you to get back usually the same day or the next day in most patients, not everyone, of course. The other thing is that because it's very superficial, there can be a little bit of minor bumpiness for a week, and that bumpiness resolves itself in 1, maybe up to 2 weeks in rare cases. Not a lot of bumpiness, it's a very superficial one. But I tell my patients now, if that bumpiness lasts a week or 2 and it's there, it's an easy fix. You don't need to come and see me, but you're welcome to do that. You take a Q-tip and you mash it, and I'm talking about very hard. You can just rub on that bump and it goes flat. So in case there's a residual bump, you want to really press on it and rub it and it goes flat. You're not going to really lose that filler. You just want to knock that bump down. It may take more than 1 time, but usually it's enough to knock down that bump. So don't worry and panic with that. When do you need to repeat this? So I have found this product is incredibly durable, is that even at 3 months, it's going to go down somewhat. You're going to lose some of it. So it's not perfect, doesn't eliminate everything one time. And the more you do, the better it gets. For people that are more aggressive budget-wise, not aggressive like looking fake, listen to my videos about why I don't make people fake. But if you have the budget, 3 to 4 months is the next round, and you do that a few times, and then over time it'll be 4 to 6, 6 to 8, 8 to 9, 9 to 12, 12 to 14, 16 to 18, 24 to 36, 36 plus. My goal is to push you past 3 to 4 years of longevity. If your budget says, look, I can't do this every couple months or 3 months, I'm not asking you to do that. Come in every 6 months. Come in once a year. Whatever your budget allows, let me stack some doses to get you to greater longevity. My ultimate goal is years, not months. And I believe with any of these fillers, which you call temporary, which you Google it, you're going to see Restylane is temporary. It is really, in my opinion, permanent. You've heard some of my videos where I talk about a lady, for example, that I did a lip reduction. I do that for corrective silicone, and Restylane squared out of her lip, and turns out she had 1 syringe 20 years ago. Had a lady in 2010, this is 2023, that she had fillers done in New York. Sorry, I did it in Dallas. She moved to New York, came back in 2022, had an MRI in 2021. 11 years later, the fillers are still there cosmetically. She still looked amazing. So these are Restylane fillers that are supposed to last 6 to 12 months. So this is not a short-term fix. I'm really trying to create long-term fix. That video I shot yesterday on the why do this? The biggest thing is not just aesthetic improvement, it's facial balance, because people always worry about looking fake. And your concept of what looks fake is someone that looks overfilled or overlifted, which I'm not going to do for you. But another reason people look fake are these perfect foreheads that look insanely awesome. And then you go to the doctor and say, well, you missed a little wrinkle. It's still not quite right. What they miss, because there's a left brain problem, watch the video on left versus right brain, that the wrinkle didn't quite go away. But they miss the fact they have advanced skin disease here because they've only managed Botox up here because they've done it over and over and over and over. And they're like, I'm used to it. I need to do it. And I have an incredibly astute eye when you come and see me that I will tell you, you don't look natural. You are having too much Botox in one area. There's not balance to your face. And what this provides, besides aesthetic improvement, is total facial balance. And so that's what makes me so darn excited about this, is that it allows me to address advanced dynamic wrinkles that cannot be addressed by lasers, even RF microneedle, which is the method I was a big fan of, and I still love it for other purposes, for medium-sized acne scar, for deep collagen issues. But this has almost taken over where RF microneedle was for me, and I've done a lot fewer RF microneedles because I'm seeing results that are so instantaneous and so targeted and so controlled toward dynamic problems. So hopefully this video gives you an understanding of the role it plays in my practice and hopefully in your life.